Good morning, everyone.
Good morning.
Good morning. I'm Amy Whitcomb Slemmer. I'm the Executive Director of Healthcare for All, and thrilled to invite all of you here to join us this morning as we kick off Patient Safety Awareness Week. We're going to learn about two new public reports on infections and serious reportable events that were recently issued by our Department of Public Health. Now, we all know what a report card is, right? For a child in school, a report card is how we measure progress, how we are held accountable. And I know when I was a student, getting a really good, important report card and topics that I cared about, getting them done well and right, helped to encourage me to be a really hard worker. And a number of years ago, Healthcare for All and its Consumer Health Quality Council advocated for public report cards for hospitals. Based on legislation we pushed and the legislature passed, our allies at DPH have now issued 3 public report cards on serious events and 2 public reports on infections. The creation of public reports on serious reportable events and infections is an example of how we can increase transparency in our healthcare system. And we at Healthcare for All believe that transparency is critically important and a vital component of our work on payment and health system delivery reform. The information included in these reports both informs consumers of the quality of care offered at Massachusetts hospitals and also helps hospitals focus on where they need to make improvements in the care that they deliver. HCFA emphasizes that transparency must be accessible and comprehensible to consumers so that we're able to use it to make better informed healthcare decisions. The specific goals of these 2 reports is to assist consumers to better understand hospital-acquired infections and what's being done to prevent them. A more knowledgeable consumer is truly a more engaged consumer, and we believe will lead to better quality health outcomes. There's another reason why we think data is so important. We support tying payment levels to overall patient outcomes. Hospitals that do well in preventing infections and other preventable complications ought to be rewarded by our payment system. Those that do not make the grade ought to be paid less. And as consumers, we want the payment system to reflect the value that we get from our healthcare providers. So this year's report cards show some real improvements in some areas. And frankly, they also highlight some ongoing challenges that we have in Massachusetts. The report cards show the need to work harder so that patients can be assured that their care is safe and that safe care is possible across the Commonwealth. The Department of Public Health is leading the way in Massachusetts and also across the country as they set the example for other states attempting to publicly report quality and cost measures. We truly appreciate their efforts to make these reports consumer-friendly, and we look forward to hearing more from our representatives from DPH. In advance of that, it is truly my pleasure to introduce some leading champions who have led the way for Massachusetts by helping to improve the quality of our healthcare system in the Commonwealth. We have Healthcare Finance Committee Co-Chair Richard Moore and Public Health Committee Co-Chair Jeff Sanchez, who will speak to us briefly. Chairman Moore.